Hello, and welcome to your benefits orientation. This is going to be a benefit overview for our Riverside, Grand Rapids, and warehouse locations. All right, let's talk benefits. So as you see on screen, there is a big orange email there that's going to be benefits@peckham.org. That is going to be the best way to contact the benefit HR team in order to ask them any questions that are benefit related. What we'll be covering today is our health and welfare benefit, retirement, medical, dental vision, basic life, voluntary life, and our short-term disability. So when can you enroll in these benefits? As a new hire, full-time employees are benefit eligible. You have 30 days from your hire date to enroll in these benefits. Full-time employees are considered full-time if they're working 30 hours or more per week consistently, and they are aware that they aren't part-time status. If you are part-time status, you will not be eligible for benefits until you are transitioned over to a full-time employee. Open enrollment is another opportunity to enroll in our benefits. This will occur in October with changes effective on January 1st of the following year. And then if you also experience a qualifying life event, you will have 31 days to enroll in benefits from that qualifying event. So that could be a loss of coverage. So if you're covered through the state or through a parent or family member, if you lose that coverage, you'd be able to sign up for Peckham insurances, the birth of a new baby, marriage, and the list goes on. If you do have something going on in your life and you're not sure if it is a qualifying event, please reach out to the HR benefits team and we'll be happy to assist you. I do want to emphasize that with these qualifying events, it is your opportunity to drop insurances as well. So if you do sign up for any insurances with us, you unfortunately are unable to drop these insurances whenever you'd like. There has to be a qualifying life event tied to that. So if you sign up for our medical, dental, vision, voluntary life, and you end up not using the dental and vision at all, and it's 6 months in and you just want to drop it, unfortunately, you're not able to do that unless you do have a qualifying life event. So any changes that do need to be made would have to be at open enrollment in October, and then those changes would go into effect the first of the following year. So do be aware of that if you are signing up for insurances. So I'll talk about our health and welfare benefit. Your SCA contract allows you to be eligible to receive a health and welfare benefit, and the primary purpose of this benefit is to help subsidize the cost of any benefits that you elect. So down here, you'll see that there's an example showing 80 hours per pay period. So at Peckham, you get paid every 2 weeks. So this person is working 40 hours per week, and you'll see the math, 80 hours times the $4.22 an hour, and you get $337.60. That is actually going to be the maximum health and welfare that you're able to receive. Any overtime worked, it does not go towards that health and welfare benefit, so it caps out at 40 hours per week. And then you'll see another example here, 64 hours per pay period. That is somebody that's working 32 hours per week, and you'll see that that math comes out to $270.08. So that is something a little bit more realistic. You do want to be aware that if your hours do go down, then so will your health and welfare, and that's what that's showing here. It can be a significant drop in the amount that you receive. So when signing up for benefits, do be aware that your hours could fluctuate, and if they do, it could potentially mean that you end up paying out of pocket for certain benefits if you do elect a few of them. And do remember that your health and welfare benefit is considered a taxable earning. With this health and welfare benefit, following your first paycheck, Peckham will create a TIAA retirement account on your behalf using the health and welfare funds. So you can choose in our workday system if you would like that to be a pre-tax traditional or an after-tax Roth 403B account. Your health and welfare funds are contributed to your TIAA retirement account until your insurances become effective, which would be 28 days in the following month. So there is going to be basically a month period there of you not receiving any benefits. So all of that health and welfare is going to go into the retirement account that you choose. So to sum it up, the health and welfare is applied to the cost of your selected benefit premiums, and any remaining health and welfare funds are contributed to this retirement account. So if you end up not signing up for any of our benefits, or if you only sign up for a few and you have remaining health and welfare, that is going to get contributed into the account that you selected, and it will continue going there. So the first plan I want to talk about is our health savings plan, and that is combined with a health savings account. So with this, the cost per paycheck is going to be $268.13 for employee only. Two-person, the cost goes up, and family coverage also goes up as well. You'll see that the deductible here is $2,000 for employee only, or $4,000 for two-person or family. Annual physicals are paid in full by Blue Care Network under this plan. So if you have an annual physical and you have this plan, that's going to be covered at 100%. However, anything else that you get done that's medically related, whether it's office visits, getting prescriptions, that all has to be paid in full until that $2,000 deductible is hit. After you hit that $2,000 deductible, any sort of medically related procedures, visits are going to be covered at 100% under this plan, as long as it is in network and covered under the plan. Once you hit that $2,000 deductible, prior to hitting that, you had to pay the full cost of prescriptions. Once you hit that $2,000 deductible, you're then going to get co-pays for your prescriptions. So that's going to be $10 for generic, $40 for preferred, and $80 for non-preferred, until you hit a max of $2,000 in RX co-pays. So for this plan, the maximum out-of-pocket is considered $4,000. That is because you have to hit the deductible of $2,000 as well as $2,000 in the RX copays. However, do remember, once you hit that first $2,000 for the deductible, then the medical procedures are going to be covered at 100%. However, you will then get copays for the prescriptions. You will also automatically be enrolled in a health savings account that you can contribute funds into. So this health savings account, it is there to have money put into it to help pay towards that deductible. So with this plan, it's tailored towards somebody who doesn't visit the doctor very often, so they wouldn't be paying towards that $2,000 deductible, so that you are able to save up money in the health savings account to pay for some rainy day where you do need a surgery or something major happens and you've got to have something done. You'll have that money in your health savings account to pay towards this $2,000 deductible. Also, with this health savings account, they will give you send you a debit card, and you can use that to pay for any medical related type things, so prescriptions and any sort of visits as well. You can choose any amount that you would like to contribute to that health savings account, and you can also make changes in the future whenever you would like as well. The next plan I'm going to talk about is the major medical plan. That's under Blue Care Network, and you'll see the cost per paycheck for employee is $352.98, and the cost does go up for two-person and family coverage. The deductible for this plan is lower. That's $500 deductible. It does have copays up front for a virtual visit, which is $10, $30 for an office copay, $50 for urgent care, and $150 for emergency room copays. This does have a co-insurance. So with this plan, you will have to hit the $500 deductible before the co-insurance kicks in. So if you go to your doctor and you just have a basic office visit, that will be covered at $30 for that visit, and any sort of extra things that you have done. So if you maybe have to get lab work, that extra stuff is what you'll be paying towards the deductible. So if that lab work costs you $120, that's going to go towards the deductible. So you'll pay that $120, go towards the deductible. Once you do enough of that and hit the $500 deductible, then the co-insurance is going to kick in. So the insurance company will pay 80% of that bill, and you will be responsible for 20%. So if you have a major surgery, you're going to pay the $500 up front, and then the co-insurance will kick in, and then you'll pay 20% of whatever is left to pay. There is a maximum out-of-pocket for this plan. So the $500 deductible does go towards this maximum out-of-pocket. So you'd have to pay $2,000 more after you're paying the 20%, once co-insurance kicks in. So once you hit that the extra $2,000, so $2,500 in total, then all medical procedures and medically related type things would be covered at 100%, as long as it's in network and covered under the plan. There is also a prescription drug plan. So generics would be $15, preferred brand would be $30, and non-preferred brand would be $50. There's a mail-in service or retail service. You can get a 90-day supply, and that would be $30 for generic and $100 for brand name. You do have to speak to your doctor about potentially getting that 90-day supply. I did mention a virtual visit earlier. So on the major medical plan, you can do a virtual visit for $10 and $59 on the health savings plan, and that's before the deductible on that plan. And you would be able to do one of these Blue Cross online visits. So it's an easy access opportunity to be able to speak with a physician for any minor or non-emergency situations. And you have some examples listed on the screen there. So if you are someone who maybe does get regular sinus infections and you kind of feel it coming on and you need to speak to a doctor about that and potentially get a prescription, this is a great way to do that. You're typically able to get in a lot quicker than trying to schedule an office visit. And you can also talk to your doctor about being able to do virtual visits with them as well. So what if you don't want health insurance? If you have healthcare coverage through a spouse or parent, you can waive the health insurance being offered at Peckham. If you qualify through the state of Michigan, you can waive the health insurance being offered at Peckham. And you can also find alternatives on the marketplace at healthcare.gov that may meet your needs. But do remember that you will most likely not qualify for the subsidies that are listed on the marketplace because Peckham does offer a qualified medical plan. Next, we'll talk about the dental and vision. That's going to be Guardian Dental and Davis Vision. For employee costs, that's going to be $16.49 per paycheck. And then you'll see it does go up for two-person and family coverage. With the dental coverage, exams and cleanings are covered you can get those every 6 months, and that's covered at 100%. And then the bite, wing, x-ray, that's going to be every 12 months and will also be covered at 100%. Any basic procedures such as fillings or simple extractions, that's going to be covered at 80%. And the major procedures such as dentures and single crown is going to be covered up to 50%. They do have orthodontic care for adults and children, and that's covered up to 50% with a $1,000 maximum lifetime coverage. There is also an annual allowance of $1,000 for basic and major services. Our vision coverage, you can get an eye exam every 12 months, and that's going to be a $10 copay. And then you can also get glasses or contacts every 12 months, and that's going to be a $25 materials copay. You have a $120 annual allowance for those glasses or contacts, so anything over that $120 you will have to pay out of pocket. Here's a knowledge check. So in this example, this is somebody who worked 80 hours per pay period, so again, 40 hours a week, and they want to sign up for the single major medical as well as the single dental vision. So the questions are, how much will be subsidized by your health and welfare benefit, and how much will you have left over to help pay for life insurance? So you'll see the math here, 80 hours times the $4.22 an hour for the health and welfare, that brings us to $337.60. So the math there, you'll see the major medical is the $352.98, and the dental is the $16.49. Once you do that math, you'll see that this person will still owe $31.87, so they'll have to pay that out of their paycheck. So to answer the question, how much will be subsidized? It's going to take the whole health and welfare benefit, and you'll still owe the $31.87. So there isn't going to be anything left over to help pay for the life insurance. If this person did want to elect life insurance, it is going to be an additional cost out of their paycheck. Here's another example. It's the exact same situation. The person wants single major medical and the single dental vision. However, this person worked 64 hours instead of the 80 hours. And you'll see that they end up owing $99.39 out of pocket for their benefits. So as I mentioned, the swing in hours could drastically affect your health and welfare, and you will have to pay more out of pocket for your insurances. So do be aware of that. Life insurance. So Peckham offers two life insurance options. There's the basic life, that's going to be no cost to you, and it's a $15,000 coverage. You'll be able to sign up for that in our Workday system. And then we do offer a voluntary life, and the prices for this do vary. The plans begin at $50,000, and you can select different tiers from there, and you'll see the cost of that as well when you're in our Workday system. This is only offered to you as a new hire. And the reason for that is because it is a guaranteed coverage. So if you've ever tried to sign up for life insurance in the past, you'll know that they go through your medical providers and they check for pre-existing conditions, and there is a chance that they could deny you that life insurance coverage. However, this is guaranteed coverage, and the plan is also portable. So if you do leave Peckham, you'll be able to continue paying for this insurance through Guardian if you would like. So it is only offered as a new hire. You will not be able to sign up for this through our open enrollment or make any changes to the amount of voluntary life insurance that you selected. And our last benefit is our short-term disability. So short-term disability pays you 60% of your normal pay while off on an approved claim. Guardian will not pay benefits for the first 7 days. Once your disability claim is awarded, Guardian will pay you directly by mailing a check. Some examples of short-term disability claims could be accidental injury that isn't work-related, pregnancy or childbirth, and illness, disease, or surgery. The cost of this short-term disability is going to be based on your wage and your age, so it's going to be a little bit different for everybody. You can see the cost of that before signing up for it in our Workday system. And it is your responsibility to file the short-term disability claim. So when you do go on an approved leave, you would be given that information on Guardian. You'll be able to contact them to start the leave and get the paperwork that you need to your doctor as well. Short-term disability is a great benefit because it does give you some sort of income while you're out on a leave. So any leave that you have at Peckham, you will be responsible for your insurance premiums. So if you sign up for the medical, dental, vision, voluntary life, you're going to have to pay those premiums at the full cost because you will not receive health and welfare if you aren't working any hours. So if you're on a leave, you're not working. So unfortunately, you would have to pay the full cost of those premiums. So that could be, upwards to hundreds of dollars that you would be responsible for. So that's where short-term disability is a great opportunity to be able to help for those when you are on an approved leave. All right. So make sure that you do elect a beneficiary for that free or voluntary life if you sign up for those. And any questions that you have, please reach out to benefits@peckham.org. We'll be happy to assist you. And you can also talk to your VSS and find out who your HR benefit rep is, and they should be able to assist you with any questions that you have as well. Thank you, and have a great day.